Good morning, everyone. Welcome all of you joining the public presentation organized by the Occupational Health Center. Today's the topic is about the 2 public advocacy campaigns to support workers. We are so pleased to have Kevin Rebeck, who is the president, and Rennie, the Health and Safety Education Director from the Manitoba Federation of Labor, to present to us. First of all, we would like to acknowledge that we are presenting this section on Treaty 1 territory, where the Occupational Health Center is located. The traditional territory of the Anishinaabe, Greek, OG Greek, Dakotas, and Diné people, and the homelands of Native nations. Occupational Health Center acknowledge that we are treaty people and recognize the history and impact of colonization on Indigenous peoples. We commit ourselves to active accountability, justice, equity, and reconciliations. For the participating in this session, you could see that we have the Q&A session, and also you could put your question on the chat box area. Kevin and Rick will be answer that, during his presentation or even after. And this session is being recorded. We'll be going to share on the social media and also on our website. So please connect with us if we cannot cover all the questions at the Q&A. And some folks may not know about Occupational Health Center. We are the community health center funded by the Winnipeg Regional Health Authorities. We located on 167 Sherbrooke Street, Winnipeg, Manitoba. We provide the services to the Manitoba workers with work-related health issues and work closely with the Joint Workplace Health and Safety Committee for training. Our service is all free, so please join our website for more information and services. So I know Kevin and Rick is going to have lots of information to present to us. Now, please join me to welcome them. I'm going to share my screen.
Great, and I will share my screen. If I can do this correctly. Great, good morning, everyone. I'm Kevin Rebeck. I'm the elected full-time president of the Manitoba Federation of Labor, and I've been a labor and community activist for over 30 years, and in my current role since 2009. I've dedicated my working life to make things better for working people, and I also serve as the chair of the MFL Occupational Health Center, along with my colleague and fellow presenter, Rennie, who's new to our MFL office. So I'll tag Rick in to give himself an introduction.
Hi, thank you, Kevin. Yeah, as Kevin said, my name is Rick Rennie. I've been here at the MFL for several months now. Started in this new calendar year as the Director of Workplace Safety and Health and Education. Prior to this, I spent 10, 12 years at the WCB, where I worked in policy and research. And then a little later, I worked at the Safe Work Manitoba branch over there as the safety culture specialist. And also was deeply involved with the QP local union over there, and yeah, basically been involved in workplace safety and health and workers' compensation and so on in one capacity or another for many years. So I'm happy to be here to have this opportunity. Thank you.
Great, yeah, I'm still a member of, Rick was my president at QP 1063. I'm on leave. WCB is my employer as well, although I haven't worked there for 23 years. So it's been a little while. All right, well, this morning, we're gonna talk about 2 of the Manitoba Federation of Labor's public advocacy campaigns. We're gonna talk about our paid sick days campaign and our recognition of workplace psychological injuries. I'm gonna talk about the paid sick days. Rick's going to take the lead and present on workplace psychological injuries. So if you do have questions along the way, you feel free to type them in the chat. If I think my presentation is going to cover them, I might just give it a quick acknowledgement and we'll get to it. And if not, I'll make sure I read it out loud for folks and that we tackle that as well. So with that, I thought first I would just say a little more about the Manitoba Federation of Labor in case folks aren't sure what that's about. The Manitoba Federation of Labor is a nonprofit organization. We are not a union ourselves. Sometimes people think we're a union. We're a group that represents unions. So we represent over 125,000 unionized workers across Manitoba. Unions pay voluntary dues to fund our work. We don't receive any money from government or any other sources, and that allows us to be pretty strong in our advocacy and criticism of government. So if you've seen my face, it's probably shaking my fist at the government of the day, demanding them do better. Largely on employment standard issues or minimum wage or health and safety. Those are really anything that impacts working families is something that we take a stand on. So our unions work very hard in a workplace to negotiate a collective agreement and to set standards above legislation for the workers that they represent. But unions care more about just their own workers. They want all workers to receive those benefits. And that's really where we come in. We try to push for legislative change. So that's two of the topics we're talking about today are things that are aspirational. We don't have them here yet, but we're pushing hard to make that happen. So at the MFL, I work with 5 other dedicated and committed full-time permanent staff, Rick being one of them now. And we also call on our over 30 different unions and their staff to help us with campaigns and advocacy efforts. And then we go out in the community as well. And we often have community partners, and we partner up with really anyone who wants the same outcome that we're pushing for, which we think is a bit more equity in society, some more rights for workers, some stronger and safer workplaces. And I know that's a goal that's shared with everyone on this call. We all want safe and healthy workplaces. So paid sick days now. The first we're going to talk about is that. Please visit our webpage and sign our letter calling on government to make this a reality. If you're not ready to take that action yet, I'll do my best to convince you over the next 15, 20 minutes to join and sign on with that. I think most people are there though. The COVID pandemic has really brought some added urgency to the basic public health recommendation to stay home when sick. We were all told that that's what we needed to do. But without paid sick leave legislation, far too many workers are forced to choose between protecting public health by staying home and doing the right thing, or going to work sick to support themselves and their families. The idea that they can skip a paycheck or go without pay for far too many workers is not a real option. So paid sick days are essential. They were essential during the pandemic to protect against infectious diseases like influenza and the COVID pandemic itself. But access to paid sick days is the only real way that Canadian workers can afford to stay home when they're sick. And Canada, we lag behind other nations globally. We're in the bottom quarter of countries without guaranteed paid sick days for workers on the first day of illness. And that's a critical measure to ensure workers are able to stay home at the first sign of symptoms, which is really what will keep us safest. So let's take stock across Canada. The rules aren't all the same. They vary a little bit. So we can take a look at, I'm going to share with you right off and I'll get to it, but this is 2022 data. So there has been a change both with BC and Canada. I'll come to that in a moment, but in 2022, here's what people were entitled to for paid sick days. Only 3 jurisdictions, federal government, Quebec and PEI provided between 1 and 3 paid sick days. Otherwise, by law, if you were sick, you have no entitlements to paid sick time at all. In fact, by law, in most jurisdictions, you can't take more than 3 unpaid days. The employer is not obliged to allow you to even miss work if you're sick and not getting paid. The only guarantee in most jurisdictions, including Manitoba, is 3 paid sick days in a year. After that, you can be subject to discipline or other things could be happening. Saskatchewan and Nunavut have no legal right at all for paid sick time. So during the pandemic, there were some temporary measures. The federal government stepped up and said that they're going to provide some measures in place for people to stay home when they're sick. But all of those have now been lifted and are gone, even though COVID is still a real experience for people. And people are catching colds and flus and also infectious diseases that are making people sick. I don't know about all of you, but during the COVID pandemic and when things were in place and there were all sorts of precautions we were taking place with regular hand washing and wearing masks, I was probably the healthiest I've ever been. For that 2-year period, I don't think I had a cold that whole time. I don't think I had the flu that whole time. And I was much more productive and healthy and active and able to engage and do things. As we open things up more, I don't think there's many people who haven't caught a sniffle in the last several months or had a flu or had something again. So we need to make sure that we make some changes here. This idea that people have to work for a month or 3 months or however long before they're entitled just for the legal right to take time off, never mind doing it without a paycheck, needs to be a thing of the past. So that's not to say that no one does have paid sick time, though. Some people do, even though the law doesn't require it. So who's got paid sick time? Well, the majority of workers do not. Canada is at 42% across the country, and no province exceeded 50%. So most people, the majority of people, do not have it. As I said, there has been 2 changes. Federal jurisdiction, and I say Canada, now has 100% coverage that 100% of federally regulated workers get 10 paid sick days. So that's not to say all Canadians get paid 10 sick days. That means if you work directly for the federal government, or if you're in a federally regulated workplace like banking or transportation, if you're in a industry that crosses provincial borders, then you fall under federal legislation. And that really only makes up about 10 to 15% of Canadian workers. The majority, 85% plus of Canadian workers, are provincially regulated workers. So that really means we need the provinces to change as well. It's not enough for us to have federal legislation. It's good. It covers some workers across the country, but it doesn't cover enough. BC as well made a change. They used to only have about 39% of people had some paid sick days. They've changed the law, and in their employment standards now, all workers are entitled to 5 paid sick days. They did a consultation, and they made a commitment that they were going to implement paid sick days, and they did a consultation that they were looking at 5, 10, or 15 paid sick days every year. And there was a very strong business lobby and push back, and they ended up only putting 5 paid sick days in place, which I still think is inadequate. It doesn't meet the need that's out there, but at least they have something guaranteed in legislation. So for all Canadians to be covered, we really need every province and territory to put into law a legal right to paid sick days, and that's what we're asking for. Who makes up in Manitoba? We had 45% of people have paid sick days. Well, who are those folks? Let's take a look. Who's more likely to have it? Well, you're more likely to have it if you make a good living. If you have a high income, often with a high income, you get added benefits, there's a bit of irony there. Often our lowest income people are the ones who can't afford to go without a paycheck, and they don't have it. But often those who make the most will have it. If you're in a larger workplace, you're more likely to have it. If you're permanent or full-time, you're more likely to have it. And then there's some sectors like health, business, finance, management. So a lot of white collar jobs, you're more likely to have it, or if you're in a highly unionized sector, you're more likely to have it. But what does that mean? What aren't we saying when we say who has it? Well, what we aren't saying and what we aren't acknowledging it is if you're low wage, if you're a racialized worker, and if you're a woman, you're probably least likely to have any kind of coverage whatsoever. That's something that absolutely needs to change, and we need to figure out how we can make that happen. So I've got a quote here from a grocery worker, because I'll let you have a read of the quote. I'll give you some homework while I speak. But many low-wage workers, many low-wage jobs or occupations with a high risk of exposure to COVID and other infectious diseases. In effect, the absence of paid sick leave legislation denies paid sick leaves to the workers who need it the most. That's not just unjust, but it's a threat to public health and to our economy. The workers who've been recognized as essential during the pandemic, I'm talking about grocery workers, talking about care workers, talking about delivery workers and cleaners, are among those denied the essential protection of paid sick days. The majority of them have no paid sick days whatsoever. The pandemic's really laid bare those inequities in our labor market, in income and working conditions. We all know that income and working conditions are the leading social determinants of health. And predictably, low-wage workers have been hit the hardest by the current crisis. Over 80% of COVID cases in Canada have been linked to long-term care, where workers are primarily racialized women earning low wages and precarious jobs. One of the biggest outbreaks was at Cardwell Meat processing plant, where mainly Filipino workers earning low wages who had no access to paid sick days. And there's outbreaks to farms that have led over to 1,000 cases and 3 deaths among migrant farm workers. So I think we're clear on the need and who needs it. Everyone needs it. We need to have that. So what are we asking for really? What's the detailed ask we're asking for? Well, we're asking for legislation to ensure everyone gets paid sick days. It needs to be universal with no exceptions. And that will only happen if we embed it in law. And I'll get to what critics say and call for and tackle some of those statements in a moment. But we're asking for it to be universal in law. We want it to be employer paid so that workers don't have to make that impossible choice between going to work sick and infectious and paying their food and rent on the table. And what we can't have is that if someone's sick, then they can fill out a form and an application and it can be sent to some other body who might take 3 weeks or a month to process it. And meanwhile, I'm going without pay for that time. So employer paid, it makes it seamless for that to occur. Just like employers pay for vacations and other things, this needs to be a cost of doing business to make sure that your workers are kept safe. And I'll get to why that's beneficial to business in a moment too. We want 10 paid sick days a year. On average, workers are ill between 7 and 12 days a year. So we want to make sure that we're providing enough that they can have some financial security and protect themselves and others in the event they get ill. That means we need 10 paid sick days a year. We're also calling for an additional 10 paid sick days a year in the event of a public health emergency. I think that's the first one in my lifetime that we've had this public health emergency that was countrywide with the COVID-19 pandemic, but it may not be the last. So ideally, legislation was also cover future public health crises, but we want 10 a year and an additional 10 if there's a public health crisis. We want it to be accessible to everyone. Some employers require a sick note even if you're missing a single day. We think that's unreasonable. If I have the flu or if I'm not able to leave my bathroom because I'm having to run to it every few minutes, I can't go and get a sick note. And frankly, doctors have told us and the public they don't want people coming into their office if they're that sick. And B, there's no medical assessment. The medical assessment a doctor says is, oh, were you throwing up and you were sick? Yep, okay, here's your doctor's note. And they have to often spend another day to go and get that doctor's note. So there is going to be periodic times, if it's for a day or two duration, the idea that they have to get notes is more of a barrier. If it's for multiple days, then that may be something that can be explored. But for a day or two here and there, the idea that they have to get medical notes is more problematic, causes more problems than it solves. So what we're asking for isn't a huge ask. So why don't governments just do it? Why isn't it just a reality? It should be. I think most people would agree. So there's a strong lobby against it. There are folks who do not want that to happen, and opponents to implementing minimum wage who are largely business owners or leaders or a strong right-wing opposition to government doing any kind of regulations. Say things like government shouldn't mandate it. Most employers already provide paid sick leave. The market could take care of this. People know their business best, and maybe small businesses can't afford it. Well, businesses need to be able to make this a priority, and they're going to see some dividends if they do that, and I'll get to that in a moment. But if we leave it to the market to happen, then 45% of people will be covered. because that's where we're at. We've left it to the market to cover it up till now, and it doesn't give people adequate coverage. It also isn't fair. Some employers are open to the idea of putting it in place, but they're worried that if they put it in place and it costs more than what their employer's paying, that they're not being competitive. So in some twisted way, to keep competitive, they have to stay at the lowest common denominator. This would level the playing field and make it fair and implement and impact everyone the same. In fact, it would be a boon to those who are already doing the right thing. It wouldn't be new costs to them, but they know that everyone's providing a safer environment when their workers go to other work sites. Businesses also say they'll have to increase prices and reduce hours of work to pay for it. That's a threat that is often used. It's the best threat business has, and they're not shy to pull it out whenever they see government doing something they don't want to do, or if anything's going to protect their bottom line. And I mean, it's true. If the absolute number they need to keep is the profit margin they made last year, and there's an extra dollars or a few dollars that they have to spend for people to have financial security when they're sick and stay home and protect their workforce and not infect other people and not come to work not being very productive, then I guess they're right. They would need to pass those costs on. The reality is that's not what happens. That's not what's happened in other jurisdictions who have implemented laws both in BC in the federal sector and also in other states that we often compare ourselves to the United States, and where different states have implemented paid sick leave. Prices has not gone up. Hours have not been cut back and reduced. There aren't a whole bunch of extra staff hanging around most workplaces that they can say, oh, we were letting extra people work, and now those extra people aren't going to be there. That doesn't happen, and the dividends of having a healthier, productive workplace often make up for any discernible shortfalls that might occur. Another one is workers will abuse it and take the days as holidays. I'll tell you, when there's a really bad employer-employee relationship, this is a true risk. If you don't respect your staff and your cause a bad relationship, and this is an option to them, then some of that may happen. Most people don't abuse it. Most people who have sick leave today don't use all their sick days every year. In fact, many of them have a sick bank that they build up, and they know it's there in the event that they or a loved one get cancer or some longer term illness, that they have sick days that will give them financial security for a longer term sickness. Will some people abuse it? Yes. Any system we create, some people will abuse. That doesn't mean they're immune to being disciplined or dealt with if there's abuse taking place. Does that mean a little more work if that's happening? Yes, it does. But I'll tell you, when there's a healthy, respectful work environment, most people follow the rules and are thankful and appreciative to have paid sick days so that they can be well when they come into work. One of the arguments given, which is one of my favorites, is they go, well, this isn't a big problem. It's not a big issue, so it should be left alone. Well, if it isn't a big problem and if it's not a big issue, then it wouldn't be a big deal if we implemented it. Like, it's a double-edged sword when they give me that argument. And if it's so infrequent that they don't see the need for it, then what would be the harm in creating it? Another point, and this one is a critical one and worth talking about, is workers come to work sick even when they have sick days. And that's true. Workers do come to work sick. That speaks more to a workplace culture. I've gone off my talking points, and I had a good one on this one. Where the heck did it go? But workers do come in sick and infectious, and many feel that that's the expectation of them, that their employer expects them to be there even when they are sick, and they internalize that. That means they come to work sick and infectious and get other people ill. That won't change if there's all the other barriers to them being able to have the option to stay home with financial security. That will take a longer time to make that change and to make sure that we're creating an environment and a society and a culture that says, if you are sick, it is okay to use your sick time. But if you have no right to paid sick time, that change can never, ever take place. So having paid sick days makes it a step in the right direction. And the last is, well, if government pays, I don't have a problem with it, which really identifies the true problem from businesses' perspective here, is that they see it strictly as a cost. They have a very short-sighted view, and if anything affects my bottom line in a way that I see as negative, I'm against it. So I'll say that paid sick days are actually good for business. There are savings. They aren't this direct line that you can see the same way that if I didn't have paid sick days last year and one of my workers is sick this year, well, I paid them a day's wage that I didn't pay, so that's an expense. Well, having paid sick days lets you have other savings. You get cost savings from greater workplace and workforce stability. Replacing workers can cost between 16 to 200% of annual compensation for that worker. So having paid sick days in place reduces turnover. A study showed in the restaurant industry there was a 50% reduction in turnover once people had paid sick days. And in Austin, Texas, a cost-benefit analysis showed that on net, city businesses stand to save $4.5 million annually, largely as a result of reduced employee turnover. In addition, the community stood to save another $3.8 million per year due to reduced flu contagion, fewer emergency room visits, and other public health benefits. I know some critics go, well, it doesn't prevent turnover. If everyone offers it, then it's not an attractive piece. And I would say that's not true. Having it available means sometimes I'm not looking to go to somewhere else that may have it, but it also means that I'm not thinking, oh, I'm sick and I'm going to take more than the 3 days the law allows me to have, and I'm probably going to get fired anyway, and I'll just go get a new job because this job has irregular schedules and pays crap wages anyway. If we start changing some of those things, people don't take that same attitude and they do stay with the business that they're with. They build a better relationship. It increases productivity. I don't know about you, but I've gone to work sick. And when I go to work sick, everyone knows it. And I'm walking around and I'm staring at my desk half the time, and I'm getting tissues and going to the bathroom, and I am not at my best. They call it, when you go into work sick, presenteeism, and it's estimated to cost, this is a United States study, but it's estimated to cost the national economy $160 billion annually, or about $234 billion when you adjust that for inflation. So most human resource executives agree that presenteeism is a problem because of productivity loss. It averages about 20% per worker, and that they risk in spreading the infection. So now it's not just me that was sick, but now I've infected 2 of my coworkers, and they're either going to miss a day or come into work at a reduced productivity level as well. There's disease and illness prevention. So again, keeping people safer, and that brings down lower overall healthcare costs. Lower healthcare costs. Many people, if they don't take paid sick time, they're going to visit the emergency room because they missed the regular hours they might have been able to go and see a doctor. They're not taking routine care for themselves. And they're more than 2.5 times as likely to have to seek emergency care for their children or relatives as well. So the majority of employers do support existing sick days, paid sick days laws. Once they're in place, they're more than happy to have them, and they allow that to be a level playing field. There's been little impact on the bottom line for employers, and communities and businesses often thrive with paid sick days. Economic growth is a recurrent outcome where they're implemented. So I put this here to get you to smile, in case I haven't said anything that makes you smile yet. But it's tough to take on this lobby that's against paid sick days. They have a powerful voice that often spread misinformation or don't want to do anything that would impact their bottom line, and they have a short-sighted vision of what that is. Business is very happy to have consumers that have income come and buy their products and services. They want a vibrant, healthy economy, but all too often they don't want to pay their fair share to make that world exist. So governments exist so that we aren't governed by a survival of the fittest, and government's role is to create a more equitable community. There's no reason a country as wealthy as Canada can't have an economy that requires all workers to have a living wage, to have paid sick days, to have a strong public health care system and pharmacare system that saves us all money, and that has public programs and services that provide a a minimum standard for living better than the one that exists today. But to do that, it requires people speaking out and calling on government to implement changes to make things better for workers. So next steps, I'm going to ask you again to visit our website, mfl.ca, to sign on to our campaign, to share that link with others and let them know about that campaign, or to call or write your MLA and find out where political parties stand on this issue. In your own work environment, to negotiate or implement paid sick days in your workplace if you don't have it already, and to use your voice and networks to push for change. All too often, even when the majority of people want something, if we don't talk about it, we're not going to get it. So making sure that we talk with our coworkers, our family and friends to get that change is a critical piece. Oh, and in this shared screen environment, I missed the chats. There are 2 questions here. So I'm going to stop my screen share and happy to take questions. And if you'd like to verbally ask them, you can do that too, or you can type them in the chat. If you'd like to do them verbally, please use the raise hand function and I'll recognize you. Karen shared with us, a study in BC found that only 25% of workers with temporary immigration status had paid sick days. Women represent the majority, 58% of non-citizen workers without sick pay leave. Yeah, that's a huge problem and issue. And David said, are there strategies used in BC to achieve paid sick days that we could apply here as well? I think one of the biggest changes there was a government. There was a government that was very open and wanting to do that. And the risk of being a little partisan here, which I will be anyway, they had an NDP government that was open to the idea of implementing paid sick days. And we do have an election in the province this month, so you can read between the lines between my direct ask to say there seems to be an obvious push and solution that helps address that. How that aligns with all your other values, I can't answer that for you, but on that front, having a government that has the political will and identifies this as a change that they know would make things better for working people certainly has an impact on what laws get passed and how they get put in place. Other questions and comments folks might have? Not all at once. Okay, well, if you think of some between now and the close of the next presentation, you'll still have a window of time to do that, but maybe I will tag in Rick to talk to us about our campaign with WCB and mental health injuries. Rick.
Thank you, Kevin. Tiffany, can everybody hear okay? Good. I was having some issues with the screen sharing, so Tiffany has kindly agreed to share my slides from her screen and to also advance my slides as we go. I'd like to speak, as Kevin said, about one of our other sort of current ongoing campaigns. This one focused on the need to expand WCB recognition and coverage for workplace mental health injuries. And I'm sure that the people here who are obviously involved in and interested in workplace safety and health and sort of related issues will be more than familiar with, you know, the fact that our awareness and the whole conversation about mental health in general and workplace mental health, that there's obviously been, you know, a pretty intense ongoing conversation about those issues. And I think, you know, we have made, I think, considerable progress in terms of reducing a lot of the stigma, reducing a lot of the barriers around recognition of mental health issues in general and workplace mental health in particular. But we do have a long ways to go. And in some ways, our current campaign is about trying to break down some of those existing, some of those sort of persistent barriers that are still out there. I think that to understand the context for our current campaign, I thought it would be helpful to and to see specifically what it is that we at the MFL would like to see addressed. I think it would be helpful to sort of summarize some of the key developments in our workers' compensation legislation over the past few years with respect to mental health and the adjudication and acceptance of mental health injuries and so on, because I think this will help provide an understanding of, first of all, what has changed over the last decade or so, and perhaps even more importantly, what hasn't changed and what we need to change with respect to coverage for mental health injuries. And you can see here on this slide, this is from the MFL website. And if you go there and click on the events and news link, it'll take you to our campaigns. And just as with the same with the previous one that Kevin spoke to around sick days, this is where you can find more information about the campaign, and it's also where you can go to participate. I'm going to put the slide up again later for anybody that needs to see it again. So Tiffany, if you could just go to the next slide, that'd be great. Thank you. So up until up until about 2015, the provisions of the Workers' Compensation Act with respect to mental health injuries had remained unchanged for many years. The Act did speak to coverage for stress, and stress was included as a form of occupational disease, which in itself had important implications for how it was adjudicated. So there were really three important aspects to those provisions as they existed up until then, and in many ways have still exist. The first is that in the case of most injuries, for example, you cut your finger in a bandsaw or any of the other sort of thousands of types of sort of traumatic injuries that we see in workplaces, those injuries, were adjudicated and are still adjudicated based on what we call the but-for standard. Essentially, it's a pretty straightforward test. But for that incident in the workplace, you would not have this injury. Pretty straightforward. So it simply had to be shown that but for some event or cause, the injury wouldn't have happened. Now, occupational disease was a subset of injury. It was included as a type of accident, but occupational diseases were adjudicated on a different standard. Occupational diseases were adjudicated on what we call the dominant cause test, which basically means that because it was and still is sort of assumed that occupational diseases, take cancer as an example. If a person develops cancer, especially if they've been in various workplaces for a number of years, it is often difficult to show a clear causal connection between that workplace exposure and your cancer. There may be other sort of intervening factors, your lifestyle, smoking, heredity, all those sort of things. So if you got a form of occupational disease, then it had to be shown not only that your work might have contributed to it, but that it was the dominant cause of your disease. So because stress, again, was classified as an occupational disease, if you were diagnosed with a kind of stress or other mental health injury, it had to be shown that your work was the dominant cause of that injury. Now, when it comes to things like psychological injuries, psychological conditions, we can all see why this would make adjudication very problematic, because we all know that work is not the only thing we do, that, we have lives outside of work. We may have what the WCB calls pre-existing conditions. All those other factors come into play. And this, of course, was a major barrier to having mental health injuries adjudicated and accepted, was the dominant cause test. Another key factor in the legislation was that occupational disease, while it included stress only as an acute reaction to a traumatic event. This provision was specifically designed to eliminate what we now call chronic onset stress or cumulative stress. In other words, if it was determined that you had the kind of stress that was brought on by not one or two really significant traumatic events, but by the accumulation of long-term, multiple, quote unquote, smaller events, then that kind of stress was specifically excluded. Also, the bar for acute and traumatic was set pretty high. For an event to be considered traumatic, generally, it had to involve something like a serious threat of physical violence, witnessing an overtly and significantly violent incident, that sort of thing. Similarly, acute, again, meant not that you had an immediate reaction, but your reaction was really significant and debilitating. So again, the dominant cause test, in addition to this sort of restriction on the type of stress that would be acceptable, and the very high bar for traumatic and acute, all of these things built sort of fences around what would be an acceptable psychological injury. Also, stress arising from human resource matters, for example, demotion, discipline, all of those things that most of us encounter and experience in the workplace, in the run of a day. Stress that arose from those things was also explicitly excluded, which on the surface of it, seems to make sense, right? My boss says, oh, you missed work 2 days last week. I'm putting a note on your file. Okay, well, I may find that a slightly stressful thing, but it's part of the rules, and that's the way it is. But we can also see how in real life, conversations, events, incidents about quote unquote human resource matters can also stray obviously over into what we might consider traumatic events. For example, these conversations can be extremely difficult. They can be extremely upsetting to people. And you also get into, this sort of gray area between, well, it's easy to lose sight of the distinction between what we call discipline, for example, and harassment. Some discipline, can border harassment. And is that a traumatic event? So again, what seem to be very simple or straightforward kinds of parameters can in fact become problematic. So these three provisions that really governed how psychological injuries were dealt with historically. So Tiffany, if you could just please go to the next slide. So one of the significant changes, or I guess I don't know how significant it is, but one of the changes that took place in 2015, which actually took effect in 2016, I think, properly speaking, but was the introduction of a presumptive provision for post-traumatic stress disorder. Now, so basically, what that provision says is that if there are two specific conditions in place, you've been exposed to a traumatic event of the type that is specified in what's commonly called the DSM, the Diagnostic and Statistical Manual of Mental Disorders. And again, the types of events that are set out in the DSM, if you take the trouble to look at them, again, it's a fairly high bar in terms of what kind of an event under the DSM would constitute a PSD triggering event. So if you have been exposed to such an event, and you have a diagnosis of PTSD, it's presumed that your employment is the dominant cause of your PTSD, unless the contrary is proven. In that sense, this is not unlike other presumptive provisions in the Act around, for example, cancer claims for firefighters and various others. And when you look at it, this change didn't really expand the scope of coverage, because if you consider that psychological injuries that were an acute response to a traumatic event were already covered, then PTSD in effect is already covered. This provision simply specified PTSD as one of those injuries and essentially made it easier, at least in theory, for those who met this test to have their claim accepted. This conversation, I recall I was at the WCB at the time in the policy and research area, and I do recall that this conversation in Manitoba initially started around providing better PTSD coverage or an acceptance for PTSD for first responders, police, ambulance, firefighters, and so on. But was ultimately expanded to apply to any worker that met the test. So simply put, conditions that cause PTSD, this should read, were added to the circumstances that can cause an occupational disease. But remember now that the narrow scope of coverage that I just talked about, which excluded things like chronic stress and so on, and the dominant cause tests were maintained. So there was a change, but many of the historical barriers were left unchanged. Tiffany, next slide, please. Thank you. In 2021, there was a fairly significant change as part of a sort of a raft of other changes. The Act was changed so that the definition of accident still included an occupational disease, but occupational disease was now sort of distinguished from PTSD or an acute reaction to a traumatic event. In other words, PTSD and these other acute reactions to traumatic events were removed from under the umbrella of occupational disease and were no longer subject to the dominant cause test, which obviously was, from our perspective, was progress. You know, it meant that a lot of those sort of barriers that were raised by the dominant cause tests were removed. But again, PTSD and other psychological injuries still had to be an acute reaction to a traumatic event, so that cumulative stress and other similar injuries were still excluded. In other words, the adjudication standard was lowered somewhat, the test, which was good, but you know, a couple of the more significant barriers were still very much in place. So Tiffany, if you could just go to the next slide, please. So we pulled some numbers, by the way. You won't get these numbers from any public documents released by the WCB. You have to get these kinds of figures through a Freedom of Information request. Don't ask me why. It's aggregate data that doesn't identify any employers or workers or anything, but you do have to go through a process that often takes a couple of months to get this kind of information. So if you look at, we pulled some numbers for 2016 to 2019. There's a bit of a gap in our data for 21 and or 20 and 21. But nonetheless, I think that these numbers do give you some idea of the effect that these various restrictions might have had around acceptance rates. As you can see, it's interesting, from 2016 to 19, first of all, the total number of claims for injuries goes up considerably from 440 to 689. This may be related to the introduction of the PTSD presumptive provision. It may also just be related to the in general, to the sort of expanding, increasing knowledge and awareness of mental health and mental health injuries, and some of the sort of reduction in the stigma. After increasing in 2017 somewhat from about 44 to just over 50%, you can see that the acceptance rate then levels off to around 50%. And then in 2022, it was up to just over 60%. This may be a result of moving away from the dominant cause tests, which I just mentioned in 2021. So it's worth noting, though, that even at 60%, this is well below the general acceptance rate for WCB claims, which historically has been around 80%. So we're still very much below that general acceptance rate. And again, about 7 years ago, it was only about half of the overall acceptance rate. It's now up to 60%, but as you can see, still a really marked difference in terms of the acceptance rate for these injuries as opposed to others. Next slide, please, Tiffany. Thank you. So I'm not going to go through this a lot in detail. I looked at I did a bit of a search at the Appeals Commission, which anybody can do on the public decisions. You can enter keywords, and I found a bunch of cases. I thought that this was an interesting one, just to show sort of how real this is, just to show how this actually really works in terms of these adjudication rules, how this kind of works in quote unquote the real world, and how it affects people, like I said, every day. This is a case of a worker who filed a WCB claim, reported multiple incidents with aggressive people. She also claimed to have had a knife pulled in front of her. It says on me, but it actually turned out it was in front of her, and an overall escalation of violence towards staff. I think this was a person who worked in probably something to do with addictions or some sort of social service agency. Psychologists diagnosed the beginning stages of PTSD. A therapist later noted a trauma associated with an accumulation, important word, of work risk and stress factors. Now, what happened here was that the WCB employs some of their own medical staff as consultants. The WCB consultants stated that the beginning stages of PTSD do not constitute PTSD under the DSM, the manual I mentioned earlier, and that the retriggering event did not meet the test for a PTSD-inducing event. So you can see how really strict adherence to these rules sort of weeds out, these cases of people who have been diagnosed with a psychological injury, and the WCB consultant suggested that it was really caused by work stress, difficulty managing demands, and fear of encountering potentially violent situations. The WCB denied the claim, saying that the incident was not traumatic in nature. Next slide, please, Tiffany, and I'll show you why they thought the incident was not traumatic in nature. The review office of the WCB upheld the decision. The Appeal Commission, and this, as you may know, is an independent external body that hears WCB appeals. It's the last line of appeal, really. They say that the worker's symptoms were predominantly related to employment-related matters, burnout, daily pressures, and stresses of work, all of which are expressly excluded from the definition of accident under the Act. Now, and this again is a really stark example of how these restrictions on acceptability impact the adjudication of claims. The Appeal Commission itself says that the person is suffering from burnout, daily pressures and stresses of work, and all of these things have contributed to her his or her, I don't know if it's a male or female, psychological injury, but nonetheless, that's excluded from the act, so tough luck. The other interesting thing about this is that the person reported that a client had pulled a knife and threatened to harm themselves, but had not threatened to harm the worker. Therefore, this was not a threat to safety under the DSM, and therefore, so basically what they're saying is this doesn't meet the test for a traumatic event because the person held the knife to themselves and not to you. So this is the kind of arbitrary sort of situation that arises under these restrictions. Tiffany, the next slide, please, and I'm almost done. So what do we need? What do we want? First of all, we want better recognition and prevention of workplace psychological injuries. Obviously, that's what we're after in the long term. We also want to, though, I know the focus of this presentation is on compensating for psychological injuries. We don't want to lose sight of the importance of prevention. There are still a lot of workplaces that are really far behind in terms of their mental health standards, in terms of their psychological health practices and programs and policies and so on. And we continually promote the national standard for psychological health and safety in the workplace. If you don't know about it, Google it and check it out. It's an excellent foundation for a good workplace safety, for a good mental health program in the workplace. Not least because in its structure kind of reflects, you know, the overall structure of any good workplace safety and health program. And again, I really encourage you to check it out. So we really need to get serious about legislative changes that eliminate these arbitrary practices, recognizing that some workplace injuries are eligible for workers' compensation and some are not. If you're injured by your work, you're injured by your work. Right now, we have these requirements that say, oh, you got to have a specific diagnosis. You got to say, oh, the causal events have to be a particular type that are in this manual. Oh, the medical condition you suffer from has to be a result of these events. All of these things have really posed artificial barriers to people accessing workers' compensation supports to which they're entitled. A few other jurisdictions are doing much better, a bit better, I should say, in this regard. BC and Ontario, for example, cover chronic onset stress. So do Saskatchewan and Alberta. And we need everyone really that cares about this issue to work through whatever channels you have and force decision makers to take down these existing arbitrary barriers. And again, I just want to mention also that the other thing that we need to go alongside this is obviously better overall mental health services. We have seen the way that the lack of mental health services and supports in the communities affects people's access even to workers' compensation benefits when it comes to the ability to get medical reports from a qualified psychiatrist, to the ability to access the treatments that they need, even when their injury is recognized by the WCB. So all this also has to be an important part of that package. And just to wrap up quickly, next slide, please, Tiffany. One small thing you can do right now is go to the MFL website, go to news events, go to campaigns, and add your voice to the many, many voices that are already calling for change through our current campaign. Thank you very much.
Thank you, Rick. Yeah, I appreciate, Kevin and Rick, giving us really good background of your campaign, and it's really great information to support workers. So please, supporting these two campaigns by visit the MFL website to sign on this. So do you have any more question on the chat. I just want to making sure before we wrap up the session here, or you could just raise your hand, just asking the question, that would be great, instead of putting on the chat. No more questions, look like. Okay. We got the questions here from Lee. What is the acceptance rate of the other claims with WCB?
Historically, it's around 80%. The WCB on average gets about, it may be less now, but historically, in recent years, the WCB gets around 40,000 claims a year, and they accept about 80% of those. Which again, as I said, is much higher than the acceptance rate for psychological injuries.
Do you have any more questions for Kevin and Rick?
Tiffany, did you say earlier you'd be sharing the presentation?
Yes.
later? So if anybody has any questions, then don't hesitate to get in touch.
Yeah, awesome. Okay, I think this is the time to wrap up the session. So once again, thank you, Kevin and Rick, for great presentation. Thank you all of you for joining this session. So that session has been already recorded. We will share with you after that, and also with the slide as well. Thank you. Hope you have a great spring and see you next month. Bye.
Thank you, Tiffany. Thanks, everyone. Bye.
Thanks all. Have a great day.
Bye-bye.